هازم الأحزاب سريع الحساب اهزم اليهود وزلزلهم يا قوي يا عزيز.
أعوذ بالله من الشيطان الرجيم. بسم الله الرحمن الرحيم. الحمد لله رب العالمين والعاقبة للمتقين والصلاة والسلام على رسوله الكريم سيدنا محمد وآله وأصحابه أجمعين برحمتك يا أرحم الراحمين. All praise is due to Allah, the Lord, cherisher, nourisher, sustainer, and master of the universe, the most gracious, the most beneficent, the most merciful. Ya Allah, it is only you that we worship and is your guidance that we seek. Ya Allah, keep us in a straight path. Ya Allah, show us the choice of blessings. Ya Allah, show us your mercy. Ya Allah, guide us. Greetings, salam, salutations on our beloved Nabi Muhammadur Rasulullah sallallahu alaihi wasallam. It's a Tuesday evening, so it's time for Medical Files, brought to you by the Islamic Medical Association of South Africa and hosted by myself, Faisal MJ Sulaiman. Assalamu alaikum wa rahmatullahi wa barakatuh to all our listeners on Radio Al Ansar, CII Radio, Voice of the Cape, Radio 786, Sirius FM, Radio Islam, and IFM Port Elizabeth, and all listening to us on audio streaming and other platforms. Our topic for discussion this evening is atrial fibrillation and other heart rhythmic disorders, and our very special guest this evening is Dr. Cassim Hansa. Dr. Hansa, assalamu alaikum wa rahmatullahi wa barakatuh, and jazakallah khair for joining me on the program this evening.
Wa alaikum salam wa rahmatullahi wa barakatuh, and assalamu alaikum wa rahmatullahi wa barakatuh to all the listeners out there.
Just to introduce our guest, Dr. Cassim Hansa has been practicing cardiology for close to 18 years and began his journey in private practice in Cape Town. Dr. Hansa then moved to a hospital in Durban for many years, and after a short sabbatical in 2017, he returned in 2018 to Lenmed eThekwini Hospital and Heart Center. He has been involved in research and presenting at meetings as well as ongoing education initiatives. Dr. Hansa, I did introduce our topic as atrial fibrillation and other heart rhythm disorders. What is atrial fibrillation?
I think before we discuss atrial fibrillation, let's talk about the electrical system of the heart. Let's get it down to basics because, to understand we're talking about electricity in the heart and people are wondering where's the electricity coming from. So basically, when you go and have an ECG done, you're picking up electrical signals from the heart.
Okay.
That's what it is. Very low voltage, very fine signals, but highly tuned equipment can pick up the different sort of electrical impulses from the heart. The heart's like a motor car engine. If I take away your battery and electrical system from your motor car, it's not going to start.
Absolutely.
It's not going to work.
Absolutely not, yeah.
So similarly, the heart has a muscular pump, but to make that muscle pump work, it has an electrical system.
Okay, interesting.
Yeah. So you've got 4 chambers in the heart. 2 of them are called ventricles. They are the main pumps. The chambers that help fill these main pumps are called atria. Okay, so the atria contract, they fill the main chambers, and then the main chambers pump out. The right side pumps blood to the lungs, and the left side pumps blood to the whole body, which means the left side is the big main pump, and the right side is the smaller, simpler pump. And that's how the blood circulates. Now, in order to get these chambers to work in a coordinated fashion, there's an electrical system that starts off in the atria on the right side. It then sends a signal to the other atrium, so they both contract at the same time. It then goes down to a little center part of the heart called the AV node. There's a small pause because while the top chambers are pumping, there's a little pause to let the blood fill the bottom chambers, and then the signal goes down to the bottom chambers, and the bottom chambers pump, and the blood circulates. So that's how it works. That's the electrical system of the heart in a nutshell.
I didn't realize the body had an electrical system. I knew we had a plumbing system, a waterworks. I mean, that's what a urologist says. But at least this is something new now.
Well, the vascular system of the heart is also a plumbing system. The heart has both electrical and plumbing.
Oh, okay. Interesting.
Right. So disorders of the electrical system in the heart is what we're talking about.
All right.
Now, when the heart beats normally, we call it sinus rhythm. In other words, that means that the top chambers help fill the bottom chamber, 2 chambers, and then the ventricles contract and the blood goes to the body. I'm keeping it very simple.
Yeah.
So to have that motion, like I said, the thing has to be coordinated. Now, there's lots of different disorders we're going to discuss, but you mentioned atrial fibrillation, so let's start there.
That being our topic.
Atrial fibrillation basically is where the top chambers don't beat so well.
Okay.
They don't follow a fixed rhythm. There's chaos in the electrical activity, and they just almost vibrate or fibrillate, we call it.
Okay.
That's just lightly shake without actually pumping completely. That means they're fairly ineffective.
Okay.
So you can imagine they're just shaking like that, not really pumping. They're not helping fill the bottom chambers. Now the bottom chambers do fill themselves anyway as they sort of relax, blood gets sucked in. But the two atria help fill them, and there's a problem with that. So that's not helping them fill completely. The electrical field is chaotic, so it's not sending a regular signal down to the bottom chambers. So the signal it's sending is just lots of signals blasting, and some of those signals are going through because the heart's very special. If you bombard it very rapidly, the bottom chambers, they'll go into ventricular fibrillation and all kinds of nonsense. So on top, they've got, it's created so well that the nodes on top actually slow down the heartbeat that's going down.
Okay.
So only some of those irregular heartbeats are going down. But what that means is that because it's beating chaotically, those heartbeats are irregular.
Okay.
So what patients often come with is they have palpitations. They find their heart racing. They find they have an irregular heartbeat.
Okay.
Sometimes it's very hard to measure blood pressure. They're giving all kinds of funny blood pressure measurements on the machines because these machines are designed for a nice sinus rhythm to measure blood pressure, not an irregular heartbeat. They go to the GP not feeling well. They're short of breath. They're tired. They're suddenly feeling a bit lethargic. They may feel palpitations or may not, and they may be going very fast, and sometimes they even go slow. So that's basically what atrial fibrillation is, irregular activity of the heart.
Okay.
Now, the problems with that, of course, is that, number one, the bottom chamber can beat too fast.
Okay.
So they can come in with a very fast heartbeat, and that's a problem. We need to slow that down. And two, the biggest problem we always speak of is developing clots. Because the chambers are not pumping, in the walls of that chamber, you can develop tiny little clots.
Okay.
If those clots come loose, especially in the left atrium, it's going to the left ventricle, it's going up out into the aorta, and the first stop is the head.
Is the head, yes.
So there's a high stroke risk with these patients.
Okay.
And that is why in a lot of these patients, we do two things in the management. Well, there's multiple things we can do, but basically we talk about controlling the heart rate. So you're on tablets that control the heart rate, often things like beta blockers and stuff, to slow down the heart rate. And then you're on some kind of blood thinner, either warfarin, which is more commercially and easily available and cheaper, or the fancier newer agents that we use, which you don't need to have regular blood tests and stuff for.
Now, what causes these irregular heartbeats?
Allah Jane.
Okay, I like that answer. I like that answer.
You know, they are, so there are certain things that can cause it. We find, I mentioned that because we had a patient today who was binge drinking, and alcohol is one of the causes.
Okay.
Any sort of high dose stimulants can cause it. Viral infection and inflammation can cause it. Heart attacks and ischemia can cause it. Operations to the chambers can cause it. There are lots of different causes, and sometimes it happens in elderly patients just by itself. It just starts by itself because of scar tissue, because of previous damaged tissue, because of previous issues they have. It just sort of starts racing by itself.
I'm glad you didn't say wear and tear.
I think we get better with age.
No, alhamdulillah. That's excellent. Just to remind our listeners that this is an interactive program, and you can call us with your questions on irregular heartbeats, etc. And our topic for discussion is atrial fibrillation and other heart rhythmic disorders. We have a cardiologist in the studio, and you can forward to us your questions via WhatsApp on 060-904-1056, 060-904-1056. Just to remind you that doctors and guests on the Medical Files program will help you with any medical problems that you pose by giving you advice on air. However, they do not have your full medical history and have not examined you. Please verify the advice given to you on air with your regular doctor who knows your medical history, allergies, etc. Neither the doctors, nor the relevant radio stations, nor the Islamic Medical Association of South Africa will take any responsibility for any adverse reaction caused by the advice given on Medical Files. Just to remind you again, it's 060-904-1056. Doc, I think I've got your first question that's come through already.
Gee.
Do energy drinks that youngsters drink containing high amount of caffeine cause arrhythmia? What is the role of chemicals like taurine and guarana in energy drinks, and are they also associated in causing arrhythmia, and what type of arrhythmia do they cause?
So it's mainly the caffeine and stuff you're worried about. Energy drinks, unfortunately, are not good for you, full stop. You shouldn't be taking them. There's stimulants, and I don't think there's any benefit to taking them. Rather just drink water.
Okay.
Now, they can stimulate heartbeats. So they can push up your resting heart rate, firstly, just your resting heart, like lots of caffeine and stuff. They can push up your basal resting heart rate. If you have things like atrial fibrillation or one of the other arrhythms, they can accelerate it. If you have predispositions to like short circuits in the heart and other things, you can actually set up to excessively stimulate these pathways and therefore get these funny heartbeats happening. So it can be linked to arrhythmia and stuff. Specifically in patients who have these sort of arrhythmias, funny heartbeats, fast heartbeats, we advise them to stay away from all stimulants. So stay away from coffees, stay away from cool drinks, anything containing high amounts of caffeine, definitely energy drinks as well, or any other those sort of caffeine sweets, boosters, whatever. Even some of these drinks that they have to help you sort of study better and focus more and concentrate. And so they all have, I try not to mention the names.
Of course.
They all have high amounts of, they haven't had high amounts of caffeine and stuff in them. So you should stay away from them.
Okay, another question comes. Assalams, what is the best heart rate? Shukran.
The best heart rate is having one. Better than not having one.
Of course.
There's no best heart rate. So heart rates are very relative to your situation and what you're doing. Generally, we say the average heart rate is 70, but that also depends on your body size, your body habitus, the weather outside, how hot or cold it is, what you've eaten, etc., etc. Anything over 100, we start calling a tachycardia or a fast heartbeat. It may be a normal rhythm fast heartbeat. For example, if you're very upset about something and getting very angry, if you run a race, if you've exerted yourself in any way, your heart rate is going to go above that. But we like to have your heart rate around about 60, 70. Very fit people have even lower heart rates of 40 and 50 sometimes.
Okay.
Well, and of course, most people, when you sleep, your heart rate does drop. When you're resting and calm, your heart rate drops. The more excited and stimulated you get, the higher the heart rate. So as long as it's around about 70, 60, 70, 80, you should be okay. Under 100.
You did mention that, there are other disorders you'd like to discuss as well.
I didn't quite finish with atrial fibrillation.
Okay.
Sorry, there's so in just and why I mentioned it is because you'll probably hear about it or come across it, and it may be suggested to you as a form of treatment. And that is that what we can do sometimes, especially if this atrial fibrillation is of recent onset and not long standing, is we can shock you. We put you to sleep and apply an electric current to your chest, exactly like you see in the movies, and that resets the heart and often can get you back into a normal rhythm. Sometimes you go back into atrial fibrillation, not because they did something wrong, but because your heart is a bit resistant to getting shocked back to normal rhythm. There are electrophysiologists who are basically, to put it crudely, cardiac electricians.
Okay.
And they are also very good at managing this, and they have techniques where now, if it's very short onset, recent onset atrial fibrillation, it's happening regularly, they have ways of treating you, finding the source inside the heart, and either burning it or freezing it inside the heart.
Okay.
And killing that sort of tissue and reducing the amount of runs of atrial fibrillation you can get. So that's basically treatment of atrial fibrillation.
Now, in layman's terms, the shocks that you referred to, do they have any side effects or after effects?
You're applying a huge amount of current across the heart. So number one, it generally happens quite safely. We don't have many issues with them, to be honest. But you can stop the heart, and if you have to shock them to restart the heart, you can put you into an adverse rhythm. If there are clots in the heart, that's why in patients who've been in atrial fibrillation for a while, two things we like to do is one, put you on blood thinners for a while to actually decrease the chance of them being clots, and two, put a pipe down, what we call a transesophageal echocardiogram. So like when you go to a cardiologist, they put the gel on your chest and a device to actually, an ultrasound device to look at the heart. We can actually look at the heart with a pipe that goes down your throat from inside and from behind that. This is a very good view of the heart when we're trying to look for clots, which is a much better way of looking for clots. So you can still have a stroke after one of these procedures. So there are risks involved. But generally speaking, it's relatively safe.
Now, from what you described, it sounds like something that's very serious. I mean, you said it can go into, you can get a stroke. You did mention that.
Absolutely.
And it seems like what's like the long-term prognosis on this? I mean,
so it's decent as long as you seek help. So if you haven't sought help and you're in atrial fibrillation for some time, you obviously have a risk of developing a stroke and having a little clot develop. As long as you're on treatment, we can control the rate quite nicely with blood with certain medications, and we can give you blood thinners. The problem is that things like warfarin are hard to manage. You have to have your blood tests regularly. You sometimes eat some foods, it goes a bit high, it goes a bit low, it keeps changing all the time. So you got to be very careful of diet when you have these sort of things like warfarin. But as long as you're in a sort of therapeutic range, the chance of you developing a stroke is much, much lower and much reduced. Yeah.
So I think management is very important.
Very, very important. These patients shouldn't be left just alone, because we have had many cases where the patient presents with a stroke.
Okay.
And we are called in to see the patient because they've got an irregular heartbeat. And obviously they've had the atrial fibrillation for some time. We don't know how long, whether it was picked up or not picked up. The clots developed, gone to the head, and now it's too late. The strokes happened.
Now, are there any obvious symptoms that one looks out for?
Not really. It's just more tiredness, shortness of breath, and irregular pulse.
Okay.
Some patients have no symptoms at all.
Oh, okay.
And others present with very fast heartbeat, feeling diaphoretic, sweaty, clammy, short of breath, unwell. So, yeah.
Now, what happens if you have comorbidities? I mean, you suffer
That's okay.
from sugar.
A lot of our patients have. A lot of our
get
patients
this type of thing.
It's just the treatment's still the same. A lot of patients do have comorbidities, especially in our population group. A lot of patients are hypertensive, a lot of diabetes, a lot of cholesterol.
Absolutely.
So these comorbidities do exist in our patients, but we just have to co-manage them as well.
Okay.
It doesn't change the management of atrial fibrillation. It may even increase the chance of atrial fibrillation.
Okay. And any age group that one you should
So we get atrial fibrillation across all age groups, but we particularly see it in elderly patients, and it develops sort of spontaneously as you get older. We can find it there, but all age groups can be affected.
I know the answer that you're going to give, but are there any preventative measures that one can take?
Make zikr and dua.
Okay. I'm glad you didn't tell me control your diet and start exercising.
No, I mean, it's basically live a healthy lifestyle.
Absolutely. Can they recover from atrial fibrillation?
Yes. So if we do manage to cardiovert you back to sinus rhythm, then your heart's back to a normal rhythm. And you need to be on medication to help keep it there. Or if the electrophysiologist fix your heart as well. Or if you remain in atrial fibrillation, as long as you treat it, and as long as you're on the therapy, you live a normal life.
Oh, excellent.
Yeah.
Excellent. Well, from what you described, I got quite worried. I got quite concerned.
I can see you feeling your pulse there, just checking that it's regular or irregular.
Yeah, of course. Now it might be irregular from what I'm hearing. You know what I mean? Yeah. I did ask you what was the main cause, and I liked your answer over there. When it comes to the blood thinners you spoke of, what happens if somebody's having some other effects of blood thinners and stops? What happens then?
So that's actually a very good question. So one of the problems we have, and often we encounter these things, that people are on blood thinners, they're living a normal life, they're in atrial fibrillation, they're fairly happy, and now suddenly they need an operation, for example. You can't have an operation with the blood thinners, obviously. So you need to come off the blood thinners for a short bit, preferably 5 or 6 days with warfarin, and then you have your blood checked, you have your operation. Straight after the operation, they start you on injections to thin your blood because they work very fast, and restart the warfarin afterwards. So you can't operate with the blood thinners on board.
Yes,
you often have
absolutely.
to come off them, have your procedure done, and then restart them thereafter. So yeah.
Okay, one of those questions came is, how do you stop an atrial fibrillation episode?
You can't. You control it.
You control it. Okay.
So basically, if you are in atrial fibrillation, or you have an irregular pulse, your pulse is bounding all over the place. Now remember, atrial fibrillation is not the only cause of a funny pulse. Sometimes people just have extra heartbeats. They feel their pulse is regular with extra heartbeats coming through and feels irregular. It could be that, could be lots of things. So if you have an irregular heartbeat, your job is to go and get an ECG. Go and see your doctor or your specialist, get an ECG done and see what it's doing. Speaking of that, the new smartwatches these days, and I'm not mentioning which ones, but there are 2 major brands out there. They can do ECGs for you.
Yes.
And it's very useful. I've had several cases come to me when the ECG on their watch picked up that they had an irregular heartbeat. And they didn't know it.
Okay.
And they kind of, and they come on their phone, and you look at their phone, and it's clearly irregular. And that's what picked it up. And obviously they then present to us with atrial fibrillation. So there's not much you can do. Obviously the idea is to be healthy, stay off all stimulants and stuff like that. This is an Islamic radio station, so I don't need to mention alcohol, but you need to stay off alcohol. And inshallah, you'll be fine. But if it does occur, get an ECG done and seek medical help, because if you catch it early, if you're going in and out of it, medication can help keep you out of it. And if you leave it for too long, like I mentioned, the stroke risk is always there.
Mm-hmm. Yeah. No, but there's no surgery involved, is there?
So no, there's no surgery involved. You don't cut yourself open for this.
Mm-hmm.
There's no sort of, when you see patients have a bypass, they got a scar down the center of the chest. You don't see that.
Mm-hmm.
But that, remember I mentioned the electrophysiologist can burn. So to that you have to go to theater, where they use wires that go up from the leg up into the heart, cross the septum, and sort of do it. Sometimes under anesthetic, sometimes not under general anesthetic, depending on the electrophysiologist. But
recently I've noticed that there's a lot of technology has advanced substantially, especially comes to cardiac. Can you just discuss some of that with us?
Involving arrhythmias.
Yeah.
So technology is, cardiology is one of those fields which is rapidly advancing, alhamdulillah. And over time, even in my sort of career, from better wires, better pipes, better devices, the technology we're talking about as far as arrhythmias go. So let's take another step or two back. You can sometimes have palpitations. For example, you feel your heart racing. It races for a little bit and goes away, or races for half an hour and goes away. This happens initially once every 2 or 3 months. Now once a week it's happening. When you go to a doctor, what we do, and we don't know what it is, it could be atrial fibrillation, but it also could be one of the some other heartbeats happening. So what we generally do is we attach an ECG machine to you that you take home called a Holter. This machine is attached to you. You can't shower with it, you can't get it wet, but you can walk around and stuff with it. You go home with it, you come back a day or 2 days later, and we can analyze it and see in the time that you attached the device, did you have any funny heartbeats and stuff? We may not be able to capture it, in which case we can then, there's a very fancy device now we have called a loop recorder. These are things we implant into your chest. Very thin, very small devices, very straightforward to implant. And they continuously monitor your heart. And if they do pick up any funny rhythms, they convey those to us. So they are extremely sophisticated devices from Rhythm.
Excellent. Okay, you're listening to Medical Files, and we are discussing atrial fibrillation and other heart rhythmic disorders. Our special guest is Dr. Cassim Hansa, and this is an interactive program. You can forward to us your questions via WhatsApp on 060-904-1056. We're going to be visiting the marketplace, and on the other side of this, we'll continue with this. Do stay with us.
The views and opinions expressed by the guest and presenters of Radio Al Ansar are not necessarily the views and opinions of Radio Al Ansar and the Al Ansar Foundation.
Discover our new range of exotic perfumes, ouds and bukhur, straight from Dubai, now available at Wonder Dates. We stock a wide selection of Nabil and Chris Adams fragrances, perfect for your unique lifestyle. But that's not
next to the Sparks Road Masjid. Contact Zain on 082 542 3070. The Watch Doctor. The Watch Doctor. Keeping time every time.
You're listening to Medical Files, brought to you by the Islamic Medical Association of South Africa and hosted by myself, Faisal M.J. Suleiman. Our topic for discussion is atrial fibrillation and other heart rhythmic disorders. And our special guest this evening is Dr. Cassim Hansa, a cardiologist. And Dr. Hansa, a question that's come through. Again, I just want to remind our listeners that this is an interactive program and you can forward to us your questions via WhatsApp on 060-904-1056. It says, Salams, doctor. Thanks for the program. Does a panic attack and anxiety cause a sudden increase in blood pressure and heart rate? How can you control this condition? Jazakallah.
That's a very good question, actually. So let's address it this way. Panic attacks do cause an elevated heart rate and an elevated blood pressure for sure. They cause an increased adrenergic tone. Your adrenaline goes up, your heart rate goes up, you constrict your vessels, and your blood pressure goes up. However, why it's an interesting question is because we do get these sort of fast heartbeats, and you can have. Let's hold the question for a second, if the listener doesn't mind, and let's discuss other kinds of heartbeats.
Okay.
So one of the things we have is you can have short circuits inside the heart.
Okay.
So like just like electrical systems, you have short circuits. The top chambers and the bottom chambers are electrically isolated. The current from the top can't go down.
Okay.
Except for a tiny space where it goes through. That tiny space is the only connection, and that's where the current is created in such a way that that's where the current goes through. That's the perfectly safest place for the current to go through. Now and then you can have a short circuit in your development as your heart folds or as your heart develops somewhere in a different space.
Okay.
It exists from birth. It's not something new that happens. And in times, you can have like extra heartbeats that occur there. What will that set up is that sets up a circuit. The current sort of goes through the short circuit, back down the main circuit, up the short, and so it creates a sort of loop. And this loop causes your heart to beat very, very fast.
Okay.
Anyway, 170, 180.
Wow.
I had one 2 weeks ago, about 230.
Okay.
So this can happen. It's we call it a supraventricular tachycardia or a re-entry tachycardia, or it's all kinds of funny names people will throw out there. But basically, it's a short circuit in the heart, making the heart beat very fast. These patients often present with sudden palpitations, shortness of breath, anxiety-like symptoms. They're not just feeling right. And they often say that they're having panic attacks or something like that. So most panic attacks are panic attacks. They're not short circuits happening in the heart.
Okay.
However, if your heart rate is going up to 170, 180, then that's not just a normal physiologic response. There's something else going on. And that's what I'm trying to say. So then you have to worry about one of these short circuits happening in the heart. As far as management of these go, we'll discuss just now. As far as panic attacks go, I don't think I'm an expert on panic and other such episodes to talk about panic attacks, but what you need to do is calm down. It's very easy. Everyone tells you to calm down. So how do you calm down? You just sit down, have a glass of water, read Auzo, take a few nice big breaths, and ask yourself, is the situation worth panicking about? Is it changing anything? Other than that, I think you need to go get a psychologist online sometime to talk to people about panic episodes.
I thought you tell me blow into a paper bag.
If you're hyperventilating and you're breathing deeply all the time, what happens is you blow off your carbon dioxide that can make you feel unwell. So then that's when the paper bag comes in.
Okay. Another question coming. Assalamu alaikum. What is it when I can hear my heart beating in my ears, mainly in the morning when I wake up while I'm still lying down?
So a lot of people can hear their heartbeats. It's not an abnormal thing. It's not an abnormal heartbeat. It's just noticing your heartbeat, especially when it's quiet, it's peaceful, there's no other noise around. If you listen carefully, the blood vessel is running close to your ears. You can hear that. The other thing is maybe you've got wax in your ears.
Okay.
So if wax is blocking out all the other disturbing noises and stuff like that, you could be hearing your heartbeat as well. The pathological causes are rare, so I'm not even going to go into it because people will start panicking for nothing. But most often just go to your doctor and have your ears checked up, tell him what's happening, and let him have a look and see if anything's going on.
Okay, salams. I'm a 62-year-old diabetic. My doctor prescribed me Cardicor 2.5 milligram. What is the drug? And I noticed that the drug masks my sugar level.
So I'm not sure about masking your sugar level. I mean, if you take your sugar levels, it shouldn't.
Sorry, I think there's a typing error here. It should read that the drug makes my sugar low. That sounds, but that's what it meant.
Again, beta blockers don't have anything to do with sugar. They are tablets that we use to help control heart rates and sometimes for blood pressure as well. So what they do is they slow down the heartbeat. They slow down conduction along the pathways, and they slow down the heartbeat, basically. I'm not sure why the GP gave you a beta blocker. We typically, for hypertension, we don't use it as a first line or a second line. We use it further down to help control blood pressure. For heart disease, if someone has coronary artery disease and narrowed arteries, so not enough blood is flowing to the heart muscle, we don't want the heart to beat too fast, because then its demand will exceed its supply. And so beta blockers can be used for that. And of course, we use it for arrhythmias and stuff as well, where it slows down the heartbeat, stops these extra heartbeats happening, stops funny heartbeats.
Another question is, what can one immediately take if one suddenly gets chest pain? I'm a female, age 63, besides reciting Jazakallah.
Right now, we're right off the arrhythmia topics.
I know, sorry.
So let's talk about heart disease. No, I'm very happy to talk about heart disease. I mean,
You're a cardiologist, so everything to do with heart. I mean,
I'm not sure about broken hearts, just physical heart, the physical, not the metaphysical.
Not the okay.
So what we're referring to, what we're worried about here is the severe crushing central chest pain. Okay, it's a heavy pain. It feels like there's a massive weight in your chest. It feels like there's a clamp gripping your chest and squeezing it. The pain often radiates down to the left side, goes up, not often, but can go to the left arm, can go up into your neck. You're often sweating and clammy with this pain, short of breath. Now, if you've got risk factors, diabetic, hypertensive, hypercholesteremic, family history, smoking, these are major risk factors. You've got multiple risk factors, and you start having these pains, we need to worry. If these pains start happening when you're walking a distance, if you're climbing stairs, this is called stable angina, but you're probably having some narrowing there, it occurs on exertion, settling with rest, you need to go and seek help. You need to go and see a doctor, speak to him about it. If it happens suddenly out of the blue, and you've got all the multiple risk factors and it's all there, then the question is, are you having a heart attack? Okay. The one safe thing you can do is take aspirin. That's about all you can do, and get yourself to some sort of medical facility as soon as possible to get an ECG done. It could be lots of other things causing the pain as well. However, you don't want to miss a heart attack.
Absolutely. Okay. Again, this heart-related questions coming. I'm just going to pose them. You can
Not
decide.
a problem. Please,
Okay.
listeners, feel free to ask any sort of questions out there. As long as it's cardiac related, we don't mind answering it.
Okay. What is the reason for inserting a pacemaker in a cardiac patient?
No, that's related. That's a relative question. That is so it's also a rhythm question, electrical question. So, what do you do when the electrical system starts failing? The wires have gone a bit rusty and broken. They don't work so well anymore. So there are certain conditions where the heart doesn't beat so well anymore. That's the one thing. The electrical current doesn't get from the top chambers to the bottom chambers so well. The connection in between, which is a very fine fiber, doesn't work so well anymore. Then what happens is we start developing what we call heart block, where the top chamber does one thing and the bottom chambers do something else. What we then do to remedy that situation is we put a pacemaker in. It's a little device. It goes in under the skin, often under the clavicle, the collarbone on the left side, or sometimes the right side. We make a small pocket there, and then we enter something called the subclavian vein, where there's a little vein under the collarbone, and then we put the wires from there all the way into the heart. We do this under X-ray guidance.
Okay.
So we will locate them into the heart, one into the atria and one to the ventricle. We always try and get them to both the chambers. And then this box then helps the heartbeat. So it senses the heartbeat in the top and then passes the heartbeat down to the bottom. Or if the heart is going too slow, then it kicks in itself. It's got its own algorithms and stuff built in, and then it'll run the heart for us. So it saves you from going too slow, bradycardia.
Okay.
There are other fancier pacemakers, just briefly. The one I'm talking about is the one for the electrical thing when the heart's going too slow. But there are pacemakers we can also put in very bad heart failure patients sometimes to help the heart failure work better. And then we were talking about arrhythmias. There's a very special device we can put in as well, especially if you're developing life-threatening funny heartbeats like ventricular tachycardia, ventricular fibrillation, cardiac standstill. That'll actually shock you. You'll shock your heart back to normal.
Okay.
So these are called implantable cardiac defibrillators, much more sophisticated devices that can be used as well. But the most common pacemaker, the one we use, is the one to help the heart beat when going too slow.
Okay. There's another question that's come through. It says, someone anonymous, Salam to all. I'm a 68-year-old guy with no chronic except gout. Okay. And lately I decided to rather use 2 saccharin small pills in my tea, coffee, and I noticed the lumps around my quads and knees are subsiding. I do have high uric acid, which I use Puricos, but why can't we buy Febusostat for uric acid? Not available in chemists. Probenecide worked well, but the FDA will do it.
I think I'm no expert on that.
Okay, all right. Okay, but I think this is more up your alley then. I asked that question. It came from a listener, and I have to show the listener that I've asked it. Okay, is Brugada syndrome an electrical disturbance in the heart, and is it regarded as an arrhythmia, and how common is it?
It's not common, but it isn't. Well, it can lead to arrhythmia. So Brugada syndrome is it's a fancy syndrome, but basically there's a problem with the way the current runs through the heart. So that can lead to some very fast abnormal heartbeats, which are bad for you. So often they cause things like sudden cardiac death or fainting and passing out. So when your heart goes into one of these very fatal arrhythmias, very dangerous arrhythmias, it's beating so fast the ventricles. So this is not atrial fibrillation. This is not related to the atria. This is the ventricles now.
Okay.
That they don't put out much blood because they're not having enough time to fill, and then you pass out. And these sort of conditions can be right. So Brugada syndrome can be one of those sort of things that lead to that syndrome. And the treatment then gets much more complicated because then we have to put in fancy devices and stuff like that. So it is a reality. I'm not sure where the listener heard about Brugada syndrome from. It's not something we commonly talk about or hear about or people know about. But yeah, there is. It's not common, but it is there.
Of course.
And that's when ECG helps because it has a particular sort of form in an ECG. So again, you're having funny heartbeats, you're passing out in young people, especially this is, or people that collapse in the sports field, pass out suddenly, or they have resuscitated sudden cardiac, so they pass out and they need to be resuscitated or shocked or whatever. Then, yeah, we need to have an ECG and that'll give us a clue of what's going on.
Okay, I've got like a minute for the ad break, but I'm going to pose this question to you very quickly. Salams, just want to inquire, had a leaking heart and an erratic heart rate. Was supposed to have a pacemaker but never had it inserted. In my teens, but should have survived this far. Now and then feel this thud and sometimes light-hearted. Also suffer from vertigo, not sure if linked. Jazakallah for a well-informed show. Sorry, light-headed, not light-hearted. Yeah, no, the word headed came at the bottom, so
yeah, it's a bit complicated. I mean, we don't have enough information there, actually, to be honest. So they've had this irregular heartbeat from the time they were children with the leaking heart valve, by the sounds of things. So that's a concern. I mean, they need to see a cardiologist properly and be assessed if they haven't seen a cardiologist already. Because, I mean, from a young age, you can have leaking valves, but I'm not sure why that's not fixed. Is it just a bit of mitral valve prolapse? Is something else going on? Is the heartbeat just extra heartbeats that they're having? It's a bit hard. There's not enough information here at all.
Okay.
And now the older, the funny heartbeats, are they still having funny heartbeats? Do they still have extra heartbeats? Because it sounds like they're having ectopic beats. There's a little thud or a little skip beat you may feel in the chest. So it may be extra heartbeats as well. But, I mean, they'll need a proper ECG and a proper assessment.
Okay, we'll take a quick ad break. We'll continue on the other side of this, inshallah.
Shimmer, sparkle, captivate. Nothing less than a masterpiece. Droplets of gold inspires precious design. Flat.
Streaming and other platforms. Our topic for discussion: atrial fibrillation and other heart rhythmic disorders, and our special guest, Dr. Cassim Hansa, a practicing cardiologist. Dr. Hansa, another question that's come through is that what is a healthy heart diet?
One that is unpalatable and not so tasty. If it tastes good, don't eat it.
I like that.
So basically, the heart, it's a diet that's out of, so it's very hard in our community, basically. But it's a lot of fresh fruit, and vegetables, cutting down your saturated fats, not margarine and stuff, please, no. And not sunflower oil either. So you cut down the oils, you cut down the fats, you use things like olive oil, but don't heat that. And small portions.
Okay.
And exercise.
I thought you would tell me Mediterranean diet.
The DASH diet is there, but it doesn't. I've yet to see our people live on the DASH diet.
Salams, can you differentiate between heart angiography and angiogram? Which procedure is better?
I don't even understand that question.
That's what
heart geography.
Angiography.
And an angiogram.
And an angiogram. Yeah.
It's the same thing.
Okay.
What the person may be asking is, what's the difference between a CT angiogram and a formal angiogram that we do?
Possible.
So I can describe that. So basically, a CT angiogram is done by radiology. It may be done as a screening procedure, or we may send you, if you've got a low risk of having heart disease or narrowed arteries, it's a dye that they inject into you via your vein. There's no wires and pipes going up into your heart and stuff like that. So it's a very non-invasive way done in a CT scanner to look at the arteries of the heart. Formal coronary angiogram that we do involves making a puncture either in your wrist of your arm or your leg and passing pipes up and injecting dye directly into the coronary arteries and having a look at them. So that's the difference, if that's what the question was. Okay,
the questions are pouring in. I'm going to ask you one more question that's come, and then we'll come back to management. I think management is important.
Okay.
What is ablation, and will it take away fibrillation?
All right. So So their ablation basically means getting rid of the tissue that's underneath, the substrate that's underneath there, either by heating the tip of a probe in that area that slowly congeals the tissue underneath it, or freezing that stuff. Now, this is what we discussed earlier when we said that there are electrophysiologists, which are cardiac electricians, which are highly skilled and do this sort of stuff. They can do atrial fibrillation ablation. In other words, they burn the areas where these things come from, or what we call pulmonary vein isolations in the pulmonary veins in the left atrium where these things occur, and they can ablate these areas. While we're on that topic, when we spoke about the short circuit in the heart, we can put you on a medication to settle it down. But if these things occur a lot and very often, then the electrophysiologist also puts another probe there, finds out where the short circuit is, and does an ablation there, and sort of heats up that area, burns it in inverted commas, and kills the tissue so it doesn't conduct anymore.
Okay.
So that's one of the managements of the short circuits in the heart as well. So they have very fancy equipment to help map these areas inside the heart. It's a slow procedure. It takes a while. You got to map the area. You got to find out where the short circuits are, or you got to find out where the atrial fibrillation is coming from, and then do the procedure as well.
Okay, I know I told you we're going to speak management, but there's another question that's coming, and
that's fine.
What is the pill in the pocket in atrial fibrillation treatment?
So, there's some good questions coming through. If someone has atrial fibrillation that happens every now and then, in other words, you're not in atrial fibrillation all the time, and you can feel that your heart is now racing suddenly, so you're aware that your heart is racing, there are certain tablets we can give you. You carry the tablet with you, and if you feel you suddenly going into atrial fibrillation, you pop one of these tablets, and it very quickly helps reset the rhythm.
Okay.
Not in everybody, but it helps.
Excellent. Okay.
Interestingly, we can also give you that same medication intravenously when you come and see us. If you've got recent onset atrial fibrillation, we can put it up in a drip and give it to you intravenously to settle your heart as well.
Okay. Let's talk management. How does one manage these conditions?
So, as we mentioned, in atrial fibrillation, we're talking about managing the rate, so control the rate so your heart doesn't go too fast, and thin the blood. In most of the other sort of funny heartbeats, the treatment is very sort of directed towards it. So if it's a short circuit in the heart, we initially try medication, settle the person down. But if it occurs often and becomes a problem, then they need an ablation as well. So then the electrophysiologist will burn that pathway. If it's the ventricular arrhythmia causing these funny heartbeats and stuff like that, there can be some sort of ablation done there as well. or you may need sort of an implantable cardiac defibrillator to sort of shock you out of those rhythms. So in a nutshell, it does involve sort of a lot of cardiology input and fine-tuning and management, basically.
Okay, Assalamu alaikum. I'm a 45-year-old who suffered a heart attack with 3 stents put in. How would you advise on managing stress levels, that is family stress, the care and treatment the family should give to the patient?
Psychosocial issues. Stress, unfortunately, stress is something that we have to live with.
Mm-hmm.
Stress is a reality. How we manage stress, there are many different ways of managing stress. And I don't think this is quite the forum to discuss management of stress. Alhamdulillah, you've had 3 stents put in. The more important thing is that now that you've had 3 stents put in, what are you doing for your lifestyle? In other words, are you taking all your medication regularly? Have you given up smoking if you're a smoker? Are you eating correctly? Are you exercising? Those are very, very important factors. And if you actually exercise regularly, if you're eating correctly, you're not smoking, not taking any stimulants, anything else like that, stress often starts helping itself with a decent exercise program, everything else. How should the family take care of the person? Well, the family should treat them normally. Unless you're in heart failure or you've got a very poor heart or your heart function is very down, you can't do anything. If your heart's still okay, you're beating well, and you're on the decent medication, you should be going on leading a fairly normal life.
Absolutely. I think, the role of family is also very important. I mean, the way they take care of you, the way they treat you.
Well, the role of the family there is to encourage you, to help push you to maintain your diet, to control your sugar properly. Because one of the biggest problems we find is we make terrible diabetics. In our population group, the diet at home is abysmal. The treats and everything else people keep taking, sugar control is really terrible. So yes, there are exceptions to it, but generally speaking, the family comes involved in helping control diet, helping encourage them to exercise, get up and do things outdoors, eat correctly, take the medication. So motivation and encouragement to live correctly.
Many times you get these false alarms. You're getting these palpitations, etc. But then they're not really arrhythmia.
So, we get a lot of referrals for palpitations, and people come in, often young, many times female, sometimes male, coming in with these palpitations they feel, often teens. And most often it's the feeling of your heart beating fast. We often do the 24-hour ECGs on these patients, and they often have these events with the ECG on board, and you can clearly see that while they think they're feeling something, the heartbeat's absolutely normal. So it's often, again, stress and anxiety related. That said, it can be missed as well. So the most important is to actually take a pulse when this happens. If your pulse is racing, we have a problem, and you need to go and seek help. But if your pulse is not racing, then it's highly likely this is not an arrhythmia, but something else causing your symptoms.
I like this question. I said, you're not going to deal with it, but it says, Salams, can doctor discuss broken heart syndrome? I like that one.
Wait.
Yes,
wait.
okay.
So, psychological broken hearts I can't help you with, right? However, there is a syndrome in cardiology where severe psychosocial stress can give you a major heart attack. Okay. Oh yes. I've had several of these patients. So severe psychosocial stress or trauma or being really upset causes spasm of your artery to such a degree that there's no blood flowing to your heart muscle, and you can have a fairly significant heart attack. It's called Takotsubo syndrome.
Okay.
I'd ask you to pronounce it, all right? But it's real, and it's actually a broken heart because of severe stress or anxiety or being upset. It's not common. Not common,
Yeah.
but it does happen, and we have seen it. The ECG looks like a proper heart attack. Everything looks like a proper heart attack. You do an angiogram, the arteries are clear.
You think of the guy, he's screaming so much, he probably get a heart attack. And he's getting so stressed, he probably get a heart attack. And then you always hear that.
So while the question was about tongue-in-cheek, there is a syndrome where you can, severe stress and being upset can cause a heart attack.
I was just considering whether I'm going to pose that question to you. Okay. We've got like 3 minutes to round up.
Gee.
I'm sure you have a message for our listeners.
Heart disease is common in our community, really common. And I think we a bit too flippant about it and a bit too, casual about it. Unfortunately, by the time we see people, it is too late.
Okay.
When you've got clogged arteries, when we're putting in stents in, when we're putting up for bypass and stuff, it's far too late. We've missed the boat. We need to start with youngsters. We need to start educating people about diet, exercise, lifestyle changes, not smoking. Oh, definitely not vaping either, because vaping is worse. No vaping, no smoking, living healthy lifestyles, and inshallah not having heart disease. You know, what happens in the end is in Allah Ta'ala's hands.
Absolutely.
We have people who have lived healthy lives, athletes have heart attacks. It has happened, and we've seen them. But again, if those people had led other lifestyles, it probably would have happened earlier. So these things can happen, but we need to do the best we can to protect ourselves against these sort of diseases.
Obviously, if you've got a family history, you'd be a bit more cautious.
You should be cautious, full stop, irrespective of family history. Where family history obviously plays a role, so does diabetes, hypertension, cholesterol. So if you've got risk factors, you have to be even more worried. And again, have yourself checked up.
I think that's absolutely vital. Dr. Cassim Hansa, thank you very much for having joined me in the program.
Jazakallah for having me.
I know, in fact, I enjoyed this thoroughly. And we've learned a lot, of course. I want to thank all the engineers at the various radio stations who have engineered for the show. And of course, I want to thank our listeners for tuning into Medical Files. Medical Files will be back with you next Tuesday evening at 8 p.m. inshallah. And before I leave you, I want to say to you that may you be in the care and protection of Allah subhanahu wa ta'ala. Until we chat again, for myself, Faisal MJ Sulaiman, do enjoy the rest of your week. And assalamu alaikum wa rahmatullahi wa barakatuh.
Assalamu alaikum wa rahmatullahi wa barakatuh.
An informative Islamic global perspective. This is Al Ansar News.
Making news this hour, the 11th of June, the news from Durban 90.4 FM, Pietermaritzburg 105.6 FM. Search continues for a man missing following a boat capsize. American Monina police search and rescue teams are at the KwaZulu-Natal south coast today. They're searching for the last remaining occupant of a boat that capsized 20 meters out at the Mkababa beach earlier today. 4 men were on board the fishing vessel in the midst of a sudden run when the incident took place. Lifeguards